Hi everyone, I'm Marisa. I'm the founder of LupusChick.com, and today you are watching a video from part of our Lupus 101 series. So this series is really for people who are experiencing lupus symptoms right now or think they might be experiencing lupus symptoms, are currently in the process of getting diagnosed, or actually have just recently gotten diagnosed. You can see this whole entire section of our Lupus 101 videos. They'll be coming up on our website, LupusChick.com, and I will also put them on our YouTube channel. So if you don't subscribe or you haven't subscribed yet, please click the subscribe button. Sorry, I'm tongue-tied today. So in this series for today, I really want to talk about the people that are currently asking themselves, do I have lupus? So I want to give you some information and education about that area, and I also want to tie in a little bit of my own experience. So if you are not familiar with lupus, or you're just becoming familiar with what lupus is, it is a chronic inflammatory autoimmune disease. Now, the majority of lupus patients have systemic lupus. There are several types of lupus, but systemic lupus is one that is diagnosed the most. And systemic means that it can occur anywhere in the body or really flare up any organ system in the body. But it really likes certain organ systems. These are the brain, the heart, the lungs, the kidney, and the skin. So when people say, I feel like I'm experiencing lupus symptoms, it can really be symptoms that are associated with any of those organ systems, which is why when you talk to different people that have lupus, you'll hear that their stories really aren't exactly the same. And that's because there really aren't any two cases that are exactly alike. Personally, for me, I've never had any kidney involvement. Mine usually attacks more of my brain and my blood and sometimes my skin and my heart. But I know a lot of people that have solely kidney involvement and they've never had any of the other issues. So everyone is different. Now, the way doctors diagnose lupus is they use a criteria of 11 different symptoms, and you'll have to meet, I believe, at least 4 of those. And they'll take that information and they'll also combine it with your blood results. So if you see your primary doctor, you will probably be referred to a specialist called a rheumatologist. And a rheumatologist treats issues like lupus, rheumatoid arthritis, scleroderma, things like that, things that have to do with the connective tissue in the body. So you will have multiple blood tests done, especially if they use more of the older way of diagnosing lupus. There are newer ways that I talk about in other videos that are just a quick blood test. It's 1 tube of blood. It's by a company called Exagen.com. That's EXAGEN.com. But they'll take all this information and they'll also take a history of how long the symptoms have been happening. And it's through all of these different things that they are able to either diagnose someone with lupus or possibly some other type of autoimmune disease. Now, while everyone can experience different symptoms in the beginning, there are some that are pretty common. Not everyone will get them, but we often hear about 4 or 5 symptoms in particular that people deal with. These are often like a crushing fatigue, and when I say crushing, it means literally no amount of sleep, no amount of napping, no amount of coffee will wake you up. So that's a big one. Also, rashes. Now, a lot of the rashes that people get will be after they're exposed to a UV light or exposed to the sun. And the rash that will usually form starts here and it sort of spreads out across the cheeks. And it sort of looks like a butterfly, right? So here are the wings, here's the body. And a lot of times you will see the butterfly used as a symbol or sort of this logo for lupus, and it's because of this butterfly rash that occurs in some people. Some other symptoms are muscle and joint pain. That's really common. And also mouth sores. And I'm trying to think. I'm sorry. I'm having a total brain fog right now, which also happens with lupus. But I think the biggies are fevers. Fevers are, I hear about fevers a lot with people, and I experience them a lot. Now, Here's the other thing. Lupus is also called a great mimicker because joint pain and fevers and fatigue, this can happen with so many other types of diseases or illnesses. Think about the last time you got a really bad like flu, you know, I try to explain to people sometimes like, oh, what does it feel like to have lupus? And I tell them it's sort of like waking up like that first day that you have the flu every single day. You're exhausted, you have pain, you have this weird fever that comes and goes. So that's why, you know, you can't just have these symptoms one time, go to the doctor. Not that I say you can, but it's very unlikely that you'll have these symptoms one time. You'll go to the doctor and they'll be like, oh, you have lupus. No, it can be so many other things. So something I found for myself and with a lot of people that I talk to on Lupus Check is these symptoms have come and gone, sometimes for years in certain people. And, you know, maybe their doctors missed it, or maybe by the time they actually saw their doctor, they weren't having these symptoms at the time. So it was a little bit harder to diagnose. Lupus isn't the easiest disease to diagnose. I've heard from different physicians, from different lupus organizations, you know, the average time of diagnosis can be anything from a year to sometimes 3 or 4 years. So I'm going to backtrack a little bit and tell you about my own personal experience really quick. You know, looking back now, I've had lupus for 17 years. I was diagnosed at 23 and I just turned 41. So I'm going into my 18th year. And when I talk to my mom, when we look back, we can see that I very clearly had this lupus rash, had these fevers, and had these different types of muscle pains and this fatigue since I was 8 or 9 years old. But when I was 8 or 9 years old, this was going back into the early 80s. So going to the doctor, I didn't go to the doctor a lot. One, because I was with a single mom and we didn't have insurance. But two, you know, lupus wasn't something that was really talked about, was really, you know, advertised, that you saw it online, you saw it in the news. So it wasn't the first thing for doctors to think. I also had a lot of other health issues since I was a baby. So, you know, I kind of just went through my early years, I went through my teen years, and then in my college years, my early 20s is when something happened, and I'll go more into that into another video of how I was actually diagnosed. But, you know, so I can very clearly see there's these periods where I had all of these symptoms, but they didn't last a long time. Maybe they last for a couple of days, or maybe if it was a bad flare, maybe they lasted for a week or two, or maybe a month. I can't really remember too much. I just remember, you know, my mom and I remember the rashes. We lived in Fort Lauderdale at the time, and we remember the fatigue and different things like that. So definitely, you know, think back if you're having symptoms like this, if you're currently in the process of going through a diagnosis, seeing a physician, think back to the times when you've had these symptoms in the past. Absolutely write them down. Maybe at some point you broke out in mouth sores. Maybe at another point you had, you know, trouble breathing and a rash, but it went away maybe in a week or two. If you remember things like that, write them down. Speak to your doctor when you are in the process of the diagnosis. And trying to think of what else. I would definitely journal. So a lot of times, you know, people who are sort of in this process of getting a diagnosis, it's multiple doctor's visits, it's multiple blood work, and different testing. So I would absolutely keep a journal. I'm a huge journaler. I talk about it a lot on Lupus Check. You know, journal how you feel every day, because it's really hard for us to remember in that, you know, 10 or 15 minutes that we get with a doctor, all the things that have happened. But if you can go back to a journal and say, like, you know, I had this week of fevers and then I was fine, and then I went in the sun and then I got this rash and I got this really strange fatigue. Like, these are all very clear signs potentially of lupus. So that could help a doctor with diagnosis. So I just have a couple notes here that I took. Excuse me. I just want to make sure that I covered everything. Something I had also written in my notes was, you know, when is it time to visit a doctor? So maybe you haven't visited a doctor yet, but if you are experiencing symptoms like this, and those are just the most common. There's other lupus symptoms like kidney issues, which, you know, maybe you're not even aware that there might be a kidney issue. Frothy urine is something that they usually talk about when people have kidney issues. Also, blood involvement, if you've ever had, say, blood clots, that's something that I've dealt with in the past, or if you've ever had miscarriages, things like that, these could all signal potential blood involvement with lupus. And then also shortness of breath, maybe chest pain, pain upon breathing. Lupus can also affect the lungs or the heart. It can make it inflamed. So you can also get something called costochondritis, which is like basically an inflammation of the connective tissue around the ribs and whatnot. So that can make it a little bit difficult and painful to breathe in. So, you know, I'm not saying everyone will experience this very clear path of, well, I had the fevers and I had the fatigue and I had the rash and I had the sores, you know, but maybe it will bounce between some of the symptoms that I just talked about. So you can visit us. We're at lupuschick.com. We talk about the different criteria that the doctors use to diagnose lupus, and you can sort of match that up with some of the symptoms that you've been having. And I would always suggest, you know, see your family physician. If you can, see a rheumatologist, because there are other diseases that are very similarly linked to lupus that, you know, you might actually have one of those, but the symptoms are just so much like overlapping that you're not really sure. If you have any questions, feel free to write a comment below or reach out to me on lupuschick.com. Just go to the contact page and that email comes directly to me and I will answer you. Just give me a little time. Sometimes it takes me a day or two to get back to people, sometimes a little bit longer. But so that's a little bit about, you know, do I have lupus? I hear that question a lot from people. They'll reach out to me and they'll say, I have A, B, and C symptoms. Do I have lupus? Well, I'm not a medical doctor. I can't tell you, but I can tell you what I've experienced. I can tell you in the hundreds or at this point, thousands of people that I've spoken to online, sort of what their beginning symptoms were. Oh, and that was something I wanted to mention before. You know, so I'd had all of these symptoms throughout my life, and then when I was finally diagnosed, I had sort of everything come out at once. And so now it was, I also had a small stroke, so it was like, okay, she has fevers, she has the rash, she had a small stroke, she has fatigue, she has severe pain. I also had Raynaud's, so which is like when your fingers, the circulation is affected, so your fingers might get really white or bluish, or they might get like a dark reddish purple. I've seen it, you know, different ways with different people. But so I had all of these things at once. So it was actually at that point easy for doctors to sort of make a diagnosis. Now, you know, I tell people I was diagnosed within 3 weeks, and it's like, oh, that seems really quick. But actually, you know, I probably had lupus since the time I was 8 or 9. So not really quick. I actually, you know, 14 years I lived without knowing what was going on. So I would definitely suggest you see your doctor. Feel free to reach out to me if you have any questions. Visit lupuschick.com. We have a lot of resources and information on the website. We also are on Instagram under Lupus Chick Official. We're on Facebook under Lupus Chick. It's one of our biggest platforms. Facebook, I always tell people, you know, if you like talking to other people, you like engaging, definitely check out our Facebook. There's a lot of women and some men on there that talk to each other so much, you know, they become friends off of our page, which is pretty cool to hear those stories. So I hope this video was somewhat helpful. Please leave a comment below and check out our YouTube channel for other videos on the Lupus 101 series. Take care.